thank you all for being here again on a Saturday. Again, we appreciate your efforts to responsibly report on this pandemic and to provide helpful and potentially life-saving information to the public. Today we have Dr. Alan Wells, Dr. Don Yealy, and Dr. John Williams, who will talk to you about our successful test development effort, a new specimen collection site, and surveillance by our researchers that is helping to track the arrival of the virus in the Pittsburgh region. After that, we will take your questions, along with the questions from reporters covering our hospitals across Pennsylvania, Maryland, New York, and Ohio. Dr. Wells.
Thank you. I'm excited to share that UPMC has developed a test for use in diagnosing patients suspected of having COVID-19 disease. We will be using this test initially for select symptomatic cases as we work to rapidly increase capacity at our central lab. Developing this test for a never-before-seen virus in the midst of a pandemic and a heavy flu season was a tremendous challenge and accomplishment, even for a renowned academic center with a long history of such test developments. Our testing capacity is essential for helping us to understand and mitigate this pandemic while properly caring for our patients and protecting our staff so that they can care for more patients. We will be able to diagnose patients within 24 hours rather than days or even weeks that we currently face with outside labs and strained capacity. Dr. Yealy will explain more about which patients we will test and how we will collect specimens, but we expect to initially test over 20 patients a day, quickly ramping up to over 100 by the end of the week, and continue rapidly increasing that capacity, filling a critical need not filled by state and commercial labs as other tests come online and are adopted by UPMC to also broaden our testing capabilities to many of our other hospital locations. UPMC's laboratory-developed test was created using the reagents already approved for making a SARS-CoV-2 test and following US CDC guidelines. It's validated under the CLIA Act of the Centers of Medicare and Medicaid Services for use as a human diagnostic. The test was created by our virology team led by Dr. Tung Fang, Assistant Professor of Pathology at Pitt and Assistant Director of Clinical Microbiology at UPMC, Dr. Charles Rinaldo, Director of Clinical Virology and Professor and Chair of the Public Health Department of Infectious Disease and Microbiology, and Dr. Stephanie Mitchell, Assistant Professor of Pathology at Pitt and Director of Clinical Microbiology at Children's Hospital of UPMC. It was implemented through the tireless work and input of Arlene Bulata, Barbara Harris, and Kathy Greenawall of the Section of Virology at UPMC Clinical Laboratories. As you can see, this was an amazing team effort by people dedicated to protecting and caring for our patients. We also, again, need to thank Dr. Paul Dupre of Pitt Center for Vaccine Research, who shared the genetic samples of SARS-CoV-2 so that we could validate this test and bring it online. I'll answer questions about the test development later, but first, Dr. Yealy will talk about our specimen collection center and our latest on our preparedness efforts. Don.
Thank you very much, Dr. Wells, and more importantly, I thank you for attending today and for people for tuning in to learn as much as they can about what's going on with the particular pandemic. As we're all aware, the testing capabilities for the COVID-19 illness in the United States were both delayed and limited. That created a lot of anxiety for people who were concerned about their own status, are they infected or not, and it also hampers the public health capabilities and our response. It's hard to craft an effective plan when we don't know really who has the infection and who doesn't. By creating our own test and using an accessible collection point, we can alleviate some of the burden on our public health partners, and we can also ease the concern of our patients by getting them the diagnosis in hours, not days. Beginning on Tuesday, we will direct patients who received physician care and have symptoms of COVID-19 illness to a specimen collection site at our building located on the South Side, 2000 Mary Street. This collection site is not open to the general public. Let me restate that. It is not open to the general public. Patients must have a physician referral. They must be approved by a UPMC infection prevention expert and must have an appointment to have their specimen collected. These specimens will be tested either by the UPMC labs or public health authorities. Let me reiterate that collection is by appointment only and only for patients with an approved referral from their physician. We are not able to test anyone who wants a test today. It has to be through this mechanism. If you show up without an appointment to our Southside location, we won't be able to obtain your sample. And you may actually hinder the ability for people who want the test under a physician's order. These specimens will be collected by trained healthcare providers who will wear the recommended protective equipment. That includes gowns, gloves, and appropriate masks or respirators. Any patient who arrives for testing will enter an isolated waiting room to ensure that they have no further contact with other patients and people. The waiting room and the collection rooms will be negative pressure, and what that means is that the air does not go out to the rest of the world until it flows through a high-efficiency particulate air filter, not much dissimilar that you might use in your house. This helps remove infectious pathogens. How do we collect a patient's specimen? It involves a swab. And what is a swab? It's a thin wire, cotton-tipped device that's inserted into your nose. It's a medical procedure. Once the specimen is collected, it'll be safely and securely transported for testing in our clinical laboratory in Oakland or to another facility. In most cases, the test from our facility will be returned within 24 hours. The result will be back, and the patients will be given guidance by their clinical team. Depending on the demand and on the capacity, we may continue to send specimens to the Pennsylvania Department of Health Laboratory in Eastern Pennsylvania or to health department laboratories with our UPMC partners in New York and Maryland. We also may and will continue to use commercial laboratories as they increase their capabilities. At the end of the day, our goal is to serve you well and to help limit this infection as fast as possible. UPMC worked 24 hours a day and 7 days a week to develop our test and to create this collection site. We expect this to be a model for others who plan to create similar types of opportunities. We know how important this capability is to protecting our patients, tracking this pandemic, and ensuring that those who are the most affected can rapidly get the best care and the most appropriate care for them. Now, Dr. Williams will tell you about his efforts to monitor the presence of this virus in our region.
Thanks, Dr. Yealy. Thanks all of you for coming. Having a clinical test to diagnose individual patients with COVID-19 is a terrific achievement, and that's really going to help care for individual patients at UPMC facilities. I'm pleased to share that we have another research testing approach that will help us detect community transmissions. While Dr. Wells' team was working on the clinical test that he just told you about, research scientists at UPMC Children's Hospital of Pittsburgh have been simultaneously developing a research test to screen samples from pools of de-identified specimens from UPMC patients with cold symptoms to see if any of them test positive for the virus. This allows us to kind of take a pulse on when the virus might be present in the region. This research team, which has been working extremely hard, has so far tested over 300 samples from adults and kids at UPMC facilities with cold symptoms. To date, none of them have tested positive for SARS-CoV-2, the virus that causes COVID-19. This does not mean that we should let down our guard, and it does not mean the virus is not here. The world is small, people travel all the time. I think what this data tell us is it strongly suggests that the virus is not widely circulating yet in our region. But COVID-19 remains a critical public health threat. I want to stress again, this test cannot be used to tell individually which specific person is positive for the virus. In light of the pandemic, working with excellent public health partners locally and at the state and regulatory authorities, we decided to test these samples using a research-only version of the CDC assay. This kind of testing is not approved for individual patients in clinical care, but it's powerful enough for this kind of mass screening. We believe that this type of community surveillance is valuable to the Pittsburgh region. Even though it can't diagnose an individual with COVID-19, it can alert public health authorities early when the virus is beginning to spread in the community, so that certain interventions that we've already started, canceling of school and events for large groups, these could be ramped up or extended for longer periods. These social distancing interventions are more effective if they're started before a virus is spreading widely in a community. The goal here is prevention before it's widely circulating, not mitigation after it's already established a foothold in our city. I also thank Dr. Paul Dupre of the Pitt Center for Vaccine Research for sharing the genetic material from the virus to allow us to develop the research test. I'll take questions momentarily.
Thank you, doctors. And thank you to the media outlets that serve our communities for your responsible reporting on COVID-19 and UPMC's preparedness. We will now take questions. We have multiple regional outlets tuning into our live stream, and they have submitted questions, so I will intersperse those with the questions of the reporters in the room. I will ask our experts to please pause before answering so I can summarize the questions into the microphone for those watching the webcast. Questions? Yes, Sean.
Dr. Wells, you told us on March 3rd that you had already begun that point developing this test. When did you actually start? And looking back, would there have been an opportunity to start earlier if you wish you had started developing this test earlier, given what has happened nationally?
Oh, yes. All right, so you told us last week that you had started developing the test. When did you start developing the test, and do you wish you had started sooner?
So thank you for the question. We definitely had wished we were starting it sooner. And in fact, well before March 3rd, we had considered developing a test, but had been in communication with the CDC and FDA and had been told that the federal and state authorities would be able to handle everything and that the emergency use authorization waiver, the EUA, was not in place at that time. And as we were in a busy flu season, we focused on other respiratory illnesses. We started developing the test about 10 days, where we planned, ordered, and then developed the test, and getting a test that is appropriate for human diagnostics has many hurdles of quality controls and reproducibility that just take time. Fortunately, I do not think we have missed the boat by coming on board now, not 2 weeks ago, as you can see from Dr. Williams' surveillance, COVID-19 disease virus, the SARS-CoV-2, appears not to be widespread. In addition to his surveillance, we have tested about half the amount of samples he has as our negatives and have not found incidentally positives. So we do not seem to have missed the boat in this case.
You tested 150 people?
We've tested
We've tested
150?
samples that you need to test as controls as you do test development. So because they're part of test development, we cannot talk about them other than as a research surveillance. and we found similar findings of Dr. Williams that the virus is not widespread in our area.
Those weren't individually identifiable
No.
Those-
More like Dr. Williams'
Right,
full prospect.
because they're before ability to do human diagnostics.
So how many people have you tested so far, either in-house or ordered through the state or Quest Diagnostics or some other test?
How many people have you tested so far?
That I would leave to Dr. Yealy and our infection control, because they control who gets tested and where it gets tested.
Yeah, and as of today, the county and the Pennsylvania Department of Health can provide those accurate data. The vast majority of our tests have gone through them, so they're the people to best answer with the accurate number. The private laboratories really have just come online within the past few days to a week.
Another question? Yes.
You know, there are two strains, they say, with the L and the S. Will these tests be able to detect what strain of the COVID-19 disease that a person is carrying?
Will these tests be able to detect which strain of the COVID-19 disease the patient is carrying?
Yeah, the SARS-CoV-2, the virus that causes COVID-19, the disease, there's a little bit of diversity as the virus sort of evolves, but they're all genetically very, very closely related. So the term different strain is a little misleading. Different strains of influenza, like flu A and flu B, are really very different. The WHO and a global agency called GISAD have analyzed over 350 genomes, full genomes of SARS-CoV-2 from around the world, and the current assays align well with all of those strains. So yes, we think that these assays will detect circulating strains.
All right, I have a question from our remote viewers. From the Beaver County Times, studies are showing that hospitals across the country are experiencing such an influx of patients that there are around 6 patients per each available hospital bed. Considering that, how is UPMC preparing for that immense influx? How many beds are available, and how many patients can you hold in your hospitals?
So we're aware of upper end experiences with the COVID outbreak across the world, including the United States. And obviously, we have not had that experience here yet. We are not having any difficulty taking care of the people who present with the concern for COVID-19 illness right now. So we are ready for you right now. Secondly, in Allegheny County alone, UPMC has well over 3,000 active beds that are available today, and can ramp that up easily to another 30 or 40% more with simple activities. We've been planning and preparing for years about threats like this. There are also second-level opportunities to identify other care locations that can be easily brought online. I am certain we could multiply the UPMC capabilities again beyond those first 2 steps. Finally, we have a 42 hospital system capability, and there's no reason why we would not be able to tap in all the resources across UPMC, in addition to coordinating with other healthcare providers here. So while I understand the question, I think we have wonderful and adequate assets right now, and I think we can ramp up, and we have those plans in existence, ready to go.
Another question? Yes.
I just want clarity, so this testing will be at all UPMC hospitals, and are you sharing the test with other healthcare systems, or is this just for UPMC?
So this testing, will it be at all UPMC hospitals, and will you share it with other facilities outside UPMC?
So the test we developed is specific for the location it's developed in, but that's the central lab that will service all hospitals that are appropriate test, send specimens to us as we can handle on the capacity. As for other systems, that will be as an as-needed basis, and for critical patients, I would see that we would not refuse. We will also have overflow. We're working with Quest Diagnostics, who is for 20 years now our partner and has testing capabilities. And we've been, of course, working with the county, state, and federal authorities for testing. And we're also working with our vendors to bring in additional testing, many of whose platforms we have distributed to multiple hospitals throughout the system. And when they're approved for human use, they will be implemented. This is a UPMC-wide effort.
Is there another question? Yes, Sean.
Have you tried to keep count of the number of people who have come in complaining of what they believe are COVID-like symptoms and/or have visits to affected areas or had contact, I believe, with people with COVID-19 who were turned down? Because I know you know, the media team knows too, the many stories we've been sent, we've seen on social media. I've spoken to at least 3 people, got another one today who emailed me, who said, and it's been hospitals all over the region, who said, I just got back from Washington State, New York, Italy. I had a fever. I called the doctor. I called the nurse. They said I couldn't get it because the Department of Health guidelines said that I didn't qualify. Or in one case, there just wasn't the capacity to test for somebody in that person's condition. Have you tried to keep count how many people fit that in your system?
Have you been keeping count of how many people have requested tests or had symptoms or exposures that might warrant testing?
So that's an excellent question, and it's an exceptionally difficult question. COVID-19 illness arrived in the world and then in the United States right in the middle of seasonal influenza season and a variety of other pathogens. And so all of the symptoms you're talking about are at their peak this time of the year, irrespective of whether COVID-19 was here or not. And trying to separate out who came with symptoms that could be related to it, who came specifically asking for COVID-19 testing, and other permutations is really simply impossible right now. So the answer is, as much as I'd like that, no. We have focused on actually answering the questions and helping to guide people with the best clinical decision-making vis-a-vis the resources that are available right now, and not so much focusing on that type of surveillance activity and kind of storytelling activity. I have no doubt that people have symptoms and have asked about the testing, and after hopefully adequate screening from their healthcare professional, a wise decision was made, and maybe that included not testing. And that can be frustrating. That's exactly why we're trying to expand the test capability by not only introducing our own test, but making sure we retain access to the other tests that are available as they become more available.
Related to that, how soon do you think we're close to the kind of drive-through testing that we've seen in other regions of the country, Minnesota, Denver, West Coast, some places on the East Coast, where literally you can get a test on demand just by sitting in your car, parking down, people taking tests in parking lots outside of driveways?
How close are we to drive-through testing of the type that we've seen in news reports where the testing is done outdoors and perhaps even with people remaining in their cars?
So that's another excellent question, and we're actively exploring that option right now because it is a very good idea, particularly for people who are not terribly symptomatic. We're at the beginning phases here in Western Pennsylvania of experiencing not only the COVID-19 illness arrival, but learning how and implementing opportunities to provide care. Our priority was to get a collection process up safe as possible and do the safety side of this right the first time. The building in the south side had negative pressure capabilities already, and we were able to design a very efficient process. The other problem is that in other locations, you may not have the weather of Western Pennsylvania, and we wanted to have a facility that would always be available, easily available, no matter what the weather was this time of the year. Obviously, as the weather changes and becomes a little bit more predictable, we can entertain those type of opportunities. Having an indoor capability allowed us to address that testing safely the most efficiently right away. But I'm certain that we'll consider other opportunities.
I have a question from the Pittsburgh Business Times. Do you think the measures that have been taken, the governor's closing of all the schools and other more local measures, either by state or local officials, will be enough to flatten the curve and prevent a surge in medical systems? If not, what else as a medical professional can we as governments, businesses, and people do now?
That's a really good question. I think the answer would be yes, in terms of, are these interventions likely to flatten the curve? We know from past epidemics and pandemics, going back to the 1918 flu over 100 years ago, that these kinds of social distancing interventions are very effective at flattening the curve of a pandemic. And recent data during the COVID pandemic from other countries have shown that countries that have taken measures like this have seen a flattening of the curve. So yes, we think they will be effective at reducing the spread.
The second half of the question is, what could we hope from the government in addition to what's been done already? And what's been done already, I think, is thoughtful and consistent with experiences around the world as well as historical experiences. So first and foremost, the government is where people turn to for reassurance and also for information. And the government has been trying to connect with people at all levels, the federal government, the state, and the local government. That's still important. We're a part of that process, but they're an important part of that process. This is where people gain understanding and comfort that we will be prepared and that they'll be able to have what's necessary to deal with this pandemic. Secondly, we deliver healthcare in a highly regulated environment, and that's done for very good reason to make sure that outside of these situations, people get the best possible care no matter where they go. But in the middle of an event like this, some flexibility in how we respond to patient care needs. You asked about alternative ways to test and alternative sites to care for people. The government's ability to help us think and implement creatively to provide care sites, the best type of care that matches to the most people's need, will help us out a lot. And I know our governmental officials are thinking about this. Finally, funding for all of this activity is important. Not only individual people who are rightfully afraid of what this might cost me and how this might affect my life today and moving forward, but also the myriad of healthcare provider and healthcare systems as well as other businesses that might be affected by this. We have to still be here during the events. We have to be here afterwards. And the government's ability to address those in a thoughtful, pragmatic way really go a long way to allowing everybody to survive and to flourish after this is over.
Any others? Yes.
I had a couple. Have you been in contact with anyone who can describe what their quarantine situation was like? Like somebody from another state, or what they're going through?
Have you been in contact with anybody perhaps in another state who's been quarantined, or perhaps an area where folks are being quarantined, and what have they told you?
Yeah, that's a good question. We're learning a lot from the experiences of others. There are other regions that have a lot more widespread circulation than we do. And certainly our colleagues in places like Seattle, where they've had a lot of disease, we've been able to learn from their experience, which despite us having these plans for years, as Dr. Yealy mentioned, it's very informative to hear from others how they've had to adapt and adjust, and that kind of guides our own planning.
If I may add to that, on both a professional and a personal level, we've been in contact. So this is not UPMC competing against the world. This is the world being very collaborative, sharing everything, sharing data, experiences. There are circulating from Seattle, from Italy, from China, what they've gone through in testing, socially, in clinical care, in hospitals. Personally, I have 3 of my former trainees are in China and are in lockdown, and we're in email and FaceTime communication as we're working on projects together and understanding what they're going through. I have colleagues also in Europe undergoing that. So,
Are they feeling anything? Is there anything weird or unknown that they are feeling?
I think the word that has been is surreal.
I think people in the area sometimes may not fully appreciate one of the benefits of being right nearby a world-class institution. Alan just mentioned it. Many of our trainees stay here and provide outstanding care to people in Western Pennsylvania, but we also populate the globe with leaders elsewhere. And those connections allow us not only to read about what's happening in other areas, whether it's China, Ireland, Italy, anywhere, but also to get some of these much more personal experiences and a better understanding even of what's available publicly. So I do really think that's an asset, and I think it's one of the things that allows us to make plans that will serve people here very well.
Yes.
What are the next steps if someone was tested positive, after they get tested at this outside location, what happens then?
What are the next steps if somebody gets tested positive who got tested at the Southside location?
So as soon as the test is positive, our experts will obviously be notified, and we will notify the patient who is positive. Also notify the appropriate governmental health officials who will have the ultimate responsibility to maintain surveillance, and their personal physician if they don't have one, or provide that for them. The next step is to decide what's the most appropriate care path, and that really depends on what symptoms they're having and their independent living situation. So our job is, together with all of those people, to put together the best individual plan. Sometimes that will mean care at home with very specific instructions. Other times that will mean care at a hospital facility. We have to match where you're at with this disease and what's needed. A lot of people who will develop COVID-19 infection will not actually have many symptoms or disabling symptoms. And those kind of people don't need to be in an emergency department, and they don't need to be in an inpatient hospital setting. So we want to make sure we do it right so that everyone who needs the care that will help them get better has that care available to them.
Okay, I have a question here from the Altoona Mirror. Is there a confirmed case at any UPMC facilities now? And if so, where?
So yes, a UPMC hospital in central Pennsylvania is treating a presumptive positive case of coronavirus infection, that's COVID-19 illness, in an inpatient who was exposed through international travel. We have other potential cases, including in Allegheny County, that we believe are positive or may be positive, and they're all travel related so far. And we're awaiting further information from the local and state public health officials. We have been planning and preparing for this situation for months. It's not a surprise that eventually someone will be a definitive positive tested case in either Pittsburgh or Allegheny County. As of today, there is not a confirmed positive case in Pittsburgh or Allegheny County. That could change at any moment. All proper infection prevention protocols are being followed. We work closely with the Pennsylvania Department of Health and our local county department. The communities that we all serve and everybody watching can be reassured that our facilities are safe, that we're staffed, and we're well equipped to handle whatever is needed next.
Any questions? Yes, Sean.
To clarify, you said you're doing the nasal swab, but you're also doing throat and sputum when you're doing this test. And generally on the south side, just to clarify, it's not like you're saying that you're still following for those patients who are tested there using your own in-house test. You're going to be following the current CDC guidelines of exposure, travel, or they fail at the test or like influenza. Is that accurate?
Oh, yes, sorry.
Right. You want to take the point?
Yeah, so it's a kind of a combination question. First is,
Yeah.
at the new facility, when it opens after this weekend, who is it that's going to be tested? Your answer is, is it using the current recommendations that are widely displayed? The answer is yes. This won't be for asymptomatic patients. This won't be for people who simply have a travel or contact. It will be people who have been seen by a physician for symptoms related to what could be a COVID-19 illness, and then also screened by an infection prevention expert, which will assess all of the other contacts things. We're increasing the capability of the tests. In other words, having more of them available. It's not infinite on day one. And so we still have to use some judgment, some careful selection about who gets tested.
As far as the test, unfortunately for the patient, we're using the most annoying method of obtaining the nasopharyngeal swab, because it is the one that's most often positive. We have designed the test to catch everyone. There will be false positives with our test. That will be sorted out on confirmation, but we feel it's more important to find everyone. As far as doing multiple specimens on each patient, that also limits the capacity. So we're focusing just on the nasopharyngeal swab.
Yes.
Can you explain the swab through the nose, why that's the most effective?
Can you explain the swab through the nose, why that is the most effective
The
procedure?
person who does it in his day job will explain.
Yeah, in fact, I'll open the package and just show you. It looks like a long, thin Q-tip. These are very small, thin, and soft. They're very flexible. So I've swabbed many people with these, including children, and trained many people to do it, and I've had it done on myself as part of training many times. It's uncomfortable and annoying, but no more. And the goal is it's got a little sort of brush on it that you put through the nose, kind of into the back of the throat. If it's done carefully, it's not that uncomfortable, but it collects both the mucus secretions and some cells from the airway, and that's where the virus is.
That part of the body is the first target-rich environment, and that's why we sample there. If there was a better place that was easier, we would do it, but this is the best place to start for virtually everybody.
All right, I have a question from WKOK 1070 AM Talk Radio in Sunbury. Should we as Pennsylvanians be more concerned given our mostly rural setting and demographics, our significantly older population?
Well, I think having concern is a very, very good thing. It's okay to be fearful. It's probably not helpful to be paralyzed or incapacitated by that concern. And the question is, what happens in a rural area? Yes, the population may be older than other populations. Older people don't get the infection more frequently, but they may have complications from the infection more frequently. So that's a reasonable concern no matter where you live. It's why we actually pay a lot of attention, even during routine flu season, about our elderly patients in the community to make sure they're immunized, that they're evaluated as quickly as possible. The next question is, what about the rural setting? And as an illness like this spreads around, how it spreads around is often not exactly the same in every community, even if the communities look very, very much the same. Then you have different types of communities. So rural settings may have less transmission person to person because of the natural social isolation, or they might have more intense pockets of it because of collections of people who otherwise widely disparate come to one area. The truth is, we have no way to know whether a rural setting is better or worse. The key thing is following the same basic advice that's been given out for the past few weeks. Wash your hands, cover your mouth. If you feel ill, don't go out into settings where you can run into other people.
May I? And the labs are a network. We have hospitals up in rural settings that are part of the network. The labs communicate through the central lab, so we all are on the same game plan. And while they will not be doing viral testing there because their labs do not have that level of capability, they are part of our network with sending either to the central lab, to the state, or our commercial partners. So we are covering those areas with the same protocols that we're covering in the cities.
Okay, we have 5 minutes remaining. Yes.
Given the case in Washington County, what Dr. Ewley just said about potentially positive cases here that you're waiting to see the results on, has UPMC implemented or contemplating now implementing anything like the VA has done with visitors and patient screening everybody at the board, or some level approaching that 15 patients like Asia has done, or I'm sorry, visitors and patients? And have you done anything for other smaller affected populations who come to your hospitals, like transplant patients, or people coming in for research who are, taking drugs for clinical trials, things like that?
So the question is, now that we know there is a presumed positive case in Washington County and we're awaiting test results from cases here, have you implemented or will you be implementing any visitation restrictions, particularly for any special or vulnerable populations?
So the simple answer to that is yes, and that actually began before knowledge of the Washington County positive case. As we've been saying, the question wasn't, do we have a positive at this exact moment? It's when it's going to happen. That's really always been the presumption here. And UPMC has developed a comprehensive screening, restriction, and otherwise interactive set of policies beyond the scope of this conference. Happy to share them with you. But as you can imagine, there's lots of portals of entry for different types of facilities. One size doesn't fit all, but one general principle really probably does fit all. And it's let's be smart and let's not introduce in a threat that doesn't actually need to be there.
Okay, I have a question from some outlets in Western Maryland. When will the tests be available to outside of those outside of Pittsburgh? And also, when will specimen collection be done outside of Pittsburgh?
UPMC is developing plans for alternative collection sites as we speak right now. Each individual healthcare facility, a hospital, actually can collect specimens right now and access either a commercial lab, a governmental lab, or when we're up running in the next 48 to 72 hours, begin to access the UPMC lab. So that will be available already. Added collection sites, as we said before, wanted to get Southside up and running using safety first, making sure that we've ironed out all the kinks, and then we will go region by region and say, what's the demand, what are the opportunities, and look through all those solutions that we've already talked about.
Is there a question? Yes.
With the south side, like if somebody goes down the south side and gets tested, and if they test positive, are you going to, because they're gonna be down there, are they then going home or are they going out into the public? Are you suggesting maybe that if somebody does have an appointment to come down to the south side to get tested, are you going to say, once you leave this office, maybe self-quarantine yourself?
So the question is, if somebody comes to the South Side facility to be tested, that would be presuming they might be positive. So after their appointment to be tested, where would they go then? Should they go be quarantined?
Well, I mean, the current CDC recommendation is if there's suspicion that a patient has COVID-19 and the test is sent, if they're well enough to be an outpatient, they should self-quarantine at home until the test results are known. So yes, if patients come, although the facility's not up, I don't see any reason we would change that policy, that if a patient comes with symptoms and their physician who screened them has decided with UPMC that they should be tested, then they would be instructed to quarantine at home until the results are known.
I think what you're asking is, the test won't be back in minutes to an hour, so it's not something that they can wait for the result there. They will be given standard instructions, because to get in, you had to have had the request, screening, and the symptoms. And we will ensure that people understand what it is they're exactly supposed to do while they're waiting. The advantage of the new test is not only it's in a local area, but you won't have the multiple days that you might have had before.
And I'd like to emphasize, for the last 2.5 months, we've been doing thousands of tests a week for respiratory viruses that are communicable and that do cause significant morbidity in susceptible and even the general public. And it was always, when you came in for a test but did not need to be an inpatient, you were told to go home and to self-quarantine, except we didn't. And that's been the rules for decades, until you hear what you have and become non-infectious. This is more vigilant, but it's nothing new.
All right, we have time for one more question. Yes.
When will we know about these potential cases in Allegheny?
That's something
When will we know about these potential cases in Allegheny County?
Yeah, that's something that the Allegheny County Health Department or Pennsylvania Department of Health really control the information. We see many patients and have been seeing many patients in whom we had varying levels of suspicion. And until they actually finish their test or we have contact with a commercial testing vendor, we don't actually really know.
All right, and that concludes the time we have allotted. Thank you all for attending. We plan to continue holding these regular updates for media as long as there is a need. In the meantime, reporters with questions are encouraged to contact our UPMC Media Relations Department at upmc.com/media. Please follow @UPMC News on Twitter for updates. If you are interested, the media here with us today is invited to tour our 2000 Mary Street facility on the South Side. We will give you a very short 15 minutes tour to see how we're set up to meet our specimen collection efforts. This tour will start at 11:30 a.m. This will be the only time we will do this. Thank you.